and welcome to our first podcast book club of Therapy Pages book club or podcast where therapists talk about the latest or even classic mental health, self-help, psychology books. We read them, so maybe you don't have to.
So how this came about was we all kind of just decided that since our clients are reading so many therapy books and coming to us and asking, is this a good book? Is this helpful for me? It might be helpful just to start reading some more therapy books and then talking about them in an open discussion. So we're glad that you're here. So I am April Faust, and I am a licensed clinical social worker.
And I'm Dory Putnam Baker, licensed clinical social worker, focusing on trauma and depression and anxiety.
And I'm Jennifer Bottinelli, licensed clinical therapist, licensed professional counselor. And I work primarily with trauma as well.
All right, let's dive in. Who likes the book? Okay, that's too broad, isn't it?
Yeah, it's a tough one, right? There are parts of this book that I think speak to important topics around mental health and concerns around mental health treatment. And then there are parts of this book that feel like they make broad sweep generalizations about, how helpful therapy can be and actually how unhelpful, right? As the title kind of speaks to how unhelpful, especially with children, right? Seems to be her focus is children and adolescents. So definitely mixed on my end. There were parts that I appreciated and then parts of this book that I just wanted to put the book down and stop reading, to be honest.
I would definitely agree with that. There are a few good points I think that she has made, but mostly I also felt very frustrated and wanted to stop reading it as well.
Mm-hmm. Yeah, April recommended that I read the book. And the first chapter, I'm like, okay, look, she's got some points. Kids are over pathologized. We give out, we diagnose everything and they think they have everything because, maybe social media, wherever they get it. So that was okay. Like, I do agree with that. I think we need to rein in some of that. However, where she goes with it and where she says it started from what's the term she uses? The mental health. I don't remember the phrase that she uses in the book, but like the mental health, like conglomerate, like that we're all like, I don't remember the term she used, but that we're all in like conspiring against teenagers to keep them in therapy and against parents. Right. So I quickly turned from, wow, she has some really good points to, wow, this is scary because she has some good points. And then these parents looking for help are going to hear this and like just turn away from any professional help because she's going to, because they're all bad, basically. Mm-hmm. So, I mean, I think her research or lack thereof and lack of like reputable sources was really problematic for me also.
Mm-hmm. Me as well. I think she was very focused on having some anecdotes in there about some friends she had or friends' kids that she knew, not actual, I think, clinicians as far as I know, any therapists, and that's the part that was concerning to me as well.
Mm-hmm. Right. Mm-hmm. Mm-hmm.
So let's I'm sorry, Jen.
Oh. Jen, you shared a really good review, and I couldn't find it. But maybe we can share that or post that because that was a perfect summary written by that gentleman about this book. So I think that's really helpful.
Mm-hmm. Mm-hmm. Yeah, I found that review about 2/3 or about maybe a half of the way through the book, and it spoke to me as well. Not so much, the idea is that there's some helpful sort of concepts, iatrogenic concerns, right, about mental health worries or mental health issues being almost sort of contagious or, I can't remember the exact definition, but that's one of her main concepts. And then the idea of, what can be unhelpful for teens and kids, which is social media and some of these other concerns. But it's just the way in which she, described her argument or put forth her argument and tone. And yeah, it felt kind of blaming at times for sure.
Mhm.
But yes, I will dig up that review and we can post it.
Yeah.
Her tone was really interesting because I had read the book first, and then when we decided to do the podcast, I went back and I listened to the book on Spotify, and she actually was the one who recorded herself reading her book on Spotify. And I think that for me, listening to her tone in the book and then also her tone in person, she just does have a very condescending tone in so many ways. And sounds very just judgmental and condescending towards therapists in general.
Yeah, I agree with that. And what you said, Jen, about all right, what's the phrase I read?
I have the definition from the book.
Yeah.
Yes. Iatrogenesis.
Iatrogenesis.
The phenomenon of a healer harming a patient in the course of treatment.
And so, yes, that happens, right? I mean, I think we're not here to say that doesn't happen, and to say that anything in her book isn't possible. It's just not as I think is not the norm. I think is what, and the way it's presented is it's the norm. So absolutely, therapists do harm. I mean, gosh, we have a local therapist now in the news, right? So I mean, it does happen.
Yeah. Absolutely. And she talks so much about that. And I think you're right. Yeah, it does happen. And it's definitely not the norm.
Right.
I think the majority of people in our profession are here to help, and we want to help, and we don't at all want to harm. And she talks a lot about therapists harming, not intentionally, but because there kind of isn't a plan in place. And how to check in with clients. And she talks a lot about that. But I personally make it a point to check in with my clients and ask them, how do you think this process is going? How are you feeling about therapy? What are your guys' thoughts about that?
Yeah, I feel like it's our duty to kind of check in and say, has this been helpful? Is there anything else? I mean, even in a session, right? As the session's closing, is there anything we didn't talk about? Or is there anything that you want clarification on that, that we did talk about, right? So,
yeah, and that generally, I think, is part of best practice to, be on a journey with your client and not necessarily dictate or decide where they need to go or, so checking in on process and progress for sure.
Yeah.
Yeah, it's interesting because the iatrogenesis, argument she ties in with how much trauma people are reporting, and that kind of connection between the therapist and the client and the therapist. Again, she doesn't say it's deliberately happening, but suggesting, or over suggesting that what a client is reporting is considered trauma, and I think that's where the bad therapy or the crisis or it works against the resilience model. And that's a piece that I have a problem with, as well, that, talking about or including a discussion of what may be trauma doesn't necessarily mean that the client is a victim and that the therapist is here to save them and they need to be in therapy in order to heal. And that's how our profession, continues to, to survive or to continue to flourish. And
Right.
I don't know if you guys got that, but that was
Yes.
sort of my sense as part of her.
Yeah, I got the impression that the statement she's making is that the mental health profession in general, maybe therapists specifically, are in the business to keep kids sick. We keep our job. I think she used a term, something like, it wasn't cash cow, but it had that connotation like, oh, this is a kid, their parents are going to pay anything, so we've got you. you know, and that's at least my experience with working with the two of you, with working with any therapist really that I can think of that I've worked with. Our job is to be out of a job, right? I mean, we you know, take clients on so that they don't need it anymore, and particularly adolescents. I mean, I can't, you know, that was a population I worked with exclusively for a long time, and it was not to keep them in, it was to teach them skills so that they can be healthy, you know, productive adults, and not, you know, and deal with crises in a way that doesn't, you know, turn their world around. And I think what she was saying was almost the exact opposite. And I, you know, I had a big problem with that. And, you know, to just use that overgeneralization that we are, you know, just kind of looking at adolescents as, you know, our bread and butter, as our, you know, that's gonna, we'll have clients for years, you know, so.
Yeah, she brought up a therapist seeing an anxious teenager. It would be much easier as a therapist to continue to see them for a long period of time because the parents will always pay. The parents will always make sure they get to a session. They're very easy to deal with compared to a long-term bipolar or schizophrenic client who could possibly be violent in your office. And I just had so many issues with those because really none of those things are true.
Right.
I personally feel when working with both of those populations that sometimes an anxious teenager is a lot harder to work with than say a long-term bipolar client.
Yeah.
So I thought that was really interesting how she was just one very, I think, judgmental in her stance on that, but also I don't think is at all correct. I think probably a lot of people would agree with me on that.
Yeah, I mean, it seems like she was taking her feelings and thoughts and preconceived ideas or experiences and generalizing it to everybody, you know, and that's where this came. So she obviously has some issues and has some thoughts or feelings about mental health treatment, and maybe it her kid that she talked about at the beginning, and maybe others, but you know, I think it was a very limited view. So I'm not to say that these things don't happen, like I said earlier, because I think, yeah, sure, they do. But it's not, I don't think it's overwhelmingly the norm. And I think, you know, that with further research or maybe looking at different sources rather than just the people that she chose, she might have, I mean, she clearly cherry picked who she was going to talk to that were going to confirm her thoughts, you know. So, you know, and she later in the book, she talked about the professor who stated DBT is the, you know, is the model of choice for adolescents. I think DBT is amazing. DBT is great for kids. Absolutely. You know, but not every therapist has to be a DBT therapist. You know, that's going back to, you know, oh, if like insurance panels wouldn't cover you if you didn't document you use CBT, right? I mean, it's not the way it works. DBT skills are great. You know, we've all been DBT trained and done groups. So, you know, sure. But that's not the only thing.
Yeah, she didn't talk much about different types of treatment modalities. It was kind of a very generalized. And I think that's probably my biggest issue in general with this book is everything is just so generalized that there's not really much nuance as far as treatment modalities, as far as therapists. That idea that, of course, you can start therapy and maybe just have a bad therapist or a therapist you don't connect with or a therapist who wasn't helpful for you. Those things definitely happen. And that's when you just speak up and say, you know, I need to see someone else, look around, find somebody who, you know, who you connect with more.
Right. Yeah. And oh, I'm sorry. Go ahead, Jen.
I was just going to say, it feels like there needs to be a part 2 to this. You know, that this is the introduction and okay, where is the second part that, you know, supports, how treatment has actually been helpful and, or just counter arguments, you know, sometimes a good argument is also based on, you know, and includes, although she does mention Bessel van der Kolk and, you know, offers some of his research to go on to discount, right, that example, trauma does not have a negative impact on the brain. And some of these things are absolutely, I'm sure, hard to measure, scientifically, definitively.
Mm-hmm.
And yet, at least in my work, I've seen how people have been impacted,
Absolutely.
and I don't work with teens primarily, so I work primarily with adults, but yeah, there is something to be said about the whole system. So it would have been nice to see then additional scholars brought in and additional support, either to disprove or prove, right? Just to open up the dialogue a little bit more.
Right. But even as she referred to Bessel van der Kolk and Gabor Mate as therapy kings, right? Or trauma kings, sorry. The trauma kings. And I think that was rather condescending and not really, I mean, they have years and teams and just so much research to support their findings, both of them, and underneath them so many people as a result of their work and other research. So I felt like that was really simplifying the trauma kings, and and not to say that everybody falls, like you said, everybody falls into that, but sure, I mean, I think it's indisputable that significant trauma, but the trauma is it's self-defined. Like we could say, oh, that looks like trauma, but that doesn't mean the person experienced trauma, like a trauma response, right? So I think it is self-defined. But I think that's indisputable that trauma affects the person, the self-defined trauma affects people and affects the brain and affects their coping. I feel like she just really minimize that. It's almost like, oh, just get up and, shake it off, or don't be so nice, or, but.
Yeah, she really tended to have a focus on trauma and ADHD, and I do believe that sometimes ADHD is over pathologized in children, probably a lot of people. But she talked a lot about talking about Mr. van der Kolk, how she talked about trauma in terms of someone having a childhood that was maybe their parents were mean to them, and then of someone being in the military and having something awful happen in the military that led to a PTSD diagnosis. But she didn't all talk about that there's criteria to have a PTSD diagnosis.
Right.
Just kind of like, well, this kid says they have trauma, and almost just kind of really I guess acting like, oh, that kid's just making that up, or we will like diagnose that kid with trauma just because they had a poor childhood. So I thought that was really interesting. Just her take on trauma in general just seems very, very negative, very blaming in a lot of ways too, very invalidating.
Yeah. And that would have been an opportunity for education, because and we all may have had this, but I know I certainly have had this experience that an adolescent comes in and says, oh, I have trauma, and we talk about it, and I'll show them the clinical definition of trauma, and then be able to redefine because they don't meet the clinical diagnostic criteria for PTSD, or what they experienced was really difficult, and it's been hard for them to deal with. It didn't meet that level, but to them it felt that way. So while validating that and also explaining that it doesn't have to be a diagnosis, right? So because I think that's something that kids feel, and she talks about that at the beginning, where these all my friends have diagnoses. If you don't have a diagnosis, there's something wrong with you. So I think that kids, and I do believe social media has a huge impact. I think TikTok, I think Instagram, I think all of it has a huge impact on what kids are seeing and how they feel. But yeah, I think we as therapists can educate and say, okay, here's what it is. Like, yeah, you hear this and you may think that that's what it is. Well, let's talk about it, right? So, and then they can figure out, oh, all right, maybe it's not trauma. Maybe it's just something really hard to deal with. Because the word trauma, first of all, is used so much, way overused, right? So I think she had an opportunity there. So again, it's kind of like what you said, nuances. Like some of what she said really, I think, makes sense, and I feel is true. It's to the level and discounting the other part of that. that I have a problem with.
Mm-hmm. Mm-hmm. Yeah, and I mean, to your point, I'm just looking at a quote, in the Trauma Kings chapter where she concludes, in other words, it represented one more attempt. And this was her discussion of complex PTSD, which is not in the DSM. It is still a point of analysis, discussion, understanding.
Right.
And there is no diagnosis code, right? But it's, little t traumas do exist. And how does that impact somebody? And then how do we, describe that or identify that as something real, right? Versus like a single incident PTSD diagnosis. So she writes that this represented one more attempt by the mental health experts to pathologize everyone, in italics. And, again, a generalization. Is that what's happening? Is that what the mental health field wants to do? Is that what it's intending to do? And that it just seems to be sort of her conclusion, at every point, that this is what this is, if that's what this is and this is bad therapy, what does good therapy look like to her? And
Right. Yeah.
how does that? And as you talked about, Dory, having a discussion with your client about what they're feeling and coming up with a understanding of it that makes sense to them. That's not something that's just pulled from social media. That's understanding, that's making sense of, that's breaking down. That's not necessarily saying, okay, here's your diagnosis. And
Exactly.
yeah.
Yeah, that's a great point. And honestly, reading this book, I'm kind of realizing I get the opinion that she doesn't really feel that there is good therapy.
That's what I was thinking
Yeah.
as Jen was saying that. Yeah.
Yeah.
Mm-hmm.
There
Yeah.
was no ideas of what to do differently or what signs of a good therapist, what she would be happy with her, her kid, the experience her kid had after being sick. Like there was no ideas about that. It was just these are all bad things.
Right. Right. And again, she makes some good points. Like I do think parenting, like the whole gentle parenting approach may have gone a little too far, right? So kids have to face adversity to learn. We do. That's how we grow. That's how we learn. So we can't take everything away. The helicopter parenting, where you go into the school and you try and make everything fine for them so they don't have any difficulty at all. They don't ever have bad feelings or get upset. Well, that's problematic. And I agree with that. And what's the alternative though? Like, to your point, she doesn't present any balance, I guess. Just this is all bad. This is where we are. Okay, well, what, where's the balance? What would be okay?
Yeah, and I mean, maybe that's where we're moving, right? We tend to be a culture that like pendulum swings, right? We go from one extreme and then we swing all the way. So it would be helpful to have more of a discussion. And I think that review that we found points that out too. It says it doesn't really answer to, some of these bigger questions about how do we take care of our kids, right? And our adolescents. Yeah. Amidst all of this, all of these diagnoses floating around and parents having to contend with that too.
Yeah. Yeah. I think this had the opportunity to be a really good book if it was just a little more balanced. She's got valid points on her end. That makes sense. It just is so overgeneralized and there is just no, I'll say it again, balance. Like I can't think of a different word, but yeah, there's not solid support on some of her research or sources because they're very skewed. And there's nobody on the other side, right, of her argument. So.
Yeah, and there were a lot of points that she made, like Jen was saying too, that you could look into research and is this true, is this not true? There's always different beliefs. But something she did say in the book that I wrote down that is just incorrect is that she said that Strattera, which is a medication used to treat ADHD at times, is a stimulant. But it's not correct. Strattera is not a stimulant. So just something like that kind of caught my eye, made me wonder how many other things in this book are just not true that she hadn't actually researched. before adding that into her book. She also the section on ADHD was just so concerning to me in a lot of ways, because she also said that ADHD does not meet the standard definition of a disorder. And again, there's criteria, in the DSM for that. But she was just kind of talking about ADHD as just this thing that kids have that doesn't really affect their functioning in life. So I think that part was concerning to me, because I don't want people to read this book and then look at ADHD as that, because there's more points to ADHD than kids who maybe can't sit still, is kind of what she was talking about, or they can't sit still in class, or they talk a lot. But there's a component to ADHD that does have some mood issues that come along with it. And then also the impulsivity, and impulsivity in kids can be extremely dangerous. So I would definitely say that that's something that would affect their lives in a very negative way, just the impulsivity in itself. So.
Yeah, I mean, look at suicidal gestures. With kids, that's almost, it's a very high percentage of being very impulsive. Very rarely do kids really plan it out and, okay, this is what I'm going to, like, it's the impulsivity, and that is concerning. So, just a lot, I think, when we've talked about this book before, I think one thing I got so upset. I mean, I was yelling at the book at times, listening to it, like, just, I was so upset. But chapter 3, where she goes in step by step of what bad therapy is. So bad therapy, teach your kids to pay close attention to their feelings. And okay, I mean, it makes sense. Notice your feelings. But I think what she's saying is like feelings beyond anything else, like just ruminate. So stay in there. And what was the second one? Step 2, induce rumination. So that's it. So yeah, I'm sick. I'm like, this is where I am. I just kind of stay in that. Step 3 was make happiness a goal, but reward emotional suffering. What? Like, I mean, that's not it. The fact that and particularly, let's say DBT, right? When we teach emotion regulation skills, teaching kids to understand their emotions, that's not rewarding emotional suffering. It's saying, oh, okay, you get this, right? So now what skills can we use? Or do you understand that maybe you're not really angry, but is there something else underneath the anger? Or maybe, was there another way you could have dealt with that emotion? Or how does that emotion come up in your body? So it's not rewarding emotional suffering, it's understanding emotional experiencing, and I get so infuriated.
And teaching them how to identify their emotions and not avoid their emotions.
Yeah. Instead of, I mean, we are a culture that tends to avoid emotions, right? I mean, we don't want to talk about anything that's uncomfortable. And so therapists teaching kids an emotional language, I don't think that's rewarding emotional suffering. And then step 4 was affirm and accommodate kids' worries. So like, so we want to validate that they have concerns, yes, but we're not gonna like make them stay there and not challenge. Like, I mean, we teach cognitive challenging skills, right? Okay, so you're worried about this, what does that mean, and what's the and we go through things, and there's little kids books written about it. So I mean, there's I feel like she just so overgeneralized. So many things. I mean, I could read all 10 of them, but we don't have to. But, and then the part about medication. So, okay, next, I think it was maybe the next chapter, the whatever, but it's, medicate. And
step 7, bad therapy, step 7, drug them.
Drug them. Right. Yeah. So that's what we do. I mean, how many of us who have worked with teens have said, oh yeah, absolutely, that's the first response. I mean, in my practice, medication is last response. Like, let's try skills. Let's try this. Let's, work on some deeper things, particularly if it's trauma or something else. Let's get to the root. And if we can, you won't need medication, possibly. But also, maybe you do, right? So, and if you do, that's okay. But she makes it sound like, oh, yeah, let's go. Like, we're in cahoots with the big pharma. And, and it's just not true, Yeah.
Yeah. Yep.
Yeah, I think that's important to bring up because once I got to that chapter of the steps of bad therapy, I think that's where some of my anger started as well. So.
Me too. Oh, and then step 8, encourage kids to share their trauma in quotes. And I think that goes back to what I said before. I don't think all of the experiences that kids define as trauma is trauma. And once we can talk about that, oftentimes they will also see that, or an individual will see that, right? So, oh, yeah, that was something that was really hard. But I mean, like when you talk about diagnostic criteria for trauma, do you have flashbacks that you feel like, it's happening now? How is it affecting you? Do you avoid the people or places you were with, whatever, right? So, what is the impact it has on your current coping? And often, it's things with parents, right? I mean, or maybe peers, but when it's things with parents, which I think she referred to quite a bit, like, oh, the parents were mean, that's more of a communication thing and, just interpersonal skills, type of thing that we can teach. And it takes the parents too, though, right? So when we work with adolescents, we also have to work with the parents. And this seems to say that we just take the kids in and, are trying to fix or whatever it is that we do. But the parents are an integral part of treatment with adolescents. And that's not brought up in this book, I don't think.
No, it's actually the opposite. I mean, that's how it's framed from the beginning, is that providers exclude parents.
Yeah.
And that, I mean, that happens. I'm sure it happens.
Yeah.
And, that's also not what happens all the time. And
it's not best practice, right?
Right. That's right. That's right. Yeah, and I think there's a component that she misses too about, around the value of talking, not necessarily talking to identify pathology, but talking to counter, potential negative effects of shame, right? So if something happens and we don't have the opportunity to talk about it or contextualize it, right? We take it in and hold on to it and personalize it and identify it as I am bad, or right. And then as that continues to morph, right, as one grows older and into an adult, it can have a real negative impact on quality of life. And like, I think she misses some of, again, the sort of the nuances around, what are the benefits, the good benefits, sure, therapy, if it's hyper focused in this direction or only doing this. But there's definitely, we want to be able to create, a healthy internal sense of self too, that comes around relationships and therapy and relationships with parents and friends.
Yeah. And that shame may be some of what kids, adolescents define as trauma, right? And so when it can be redefined as shame, or looked at attachment and things like that, I mean, that's eye-opening, and that can be transformative for both the kid and the parents. Like, that's where the work with the parents comes in, and that's where interpersonal skills are just so helpful for both, right? So yeah, that's a really good point, Jen.
Yeah, and I just want to, she doesn't talk about parts work, and that's work that I do with my clients, that I found and we found to be exceptionally helpful. But yeah, like being able to incorporate other sorts of modalities that can acknowledge, right, that the shame is a part, or the depression is a part, the anxiety is a part, or maybe the trauma even, or the experience, right? It's the experience of the event that makes it traumatic. It's not the event itself, right? And what that induces. To be able to have a discussion about that doesn't then pathologize, right? It's about understanding and accepting and creating some resilience around. And
and even looking at something from a different perspective that maybe a therapist could offer too. I think to me it feels that she does not feel that talking about your feelings in general is helpful.
Right.
She's mentioned that a few times. Yeah. She even talked about debriefing police officers who have experienced trauma, that they reported feeling worse after the debriefing. I'm not.
I don't think research supports that.
No, it does not.
Yeah, I mean, that's one of your specialties now, April, and I have done critical incident debriefing, and the research does not support that.
No, not at all. Yeah.
Yeah.
So I thought that was really interesting. I mean, the research supports that the sooner after a traumatic event that you're able to debrief and process, especially with your peers who have been there and the therapist, that the chances of you developing PTSD are actually much smaller than
Exactly.
Yeah, that's right.
Yeah.
Does she reference critical incident debriefing in her? I remember reading that section, but I don't remember.
I don't think so.
don't remember either. She just had that one section where she talked, and I heard this when I was listening to it on Spotify, so I'll have to find it in the book, but she just talked about that doing research on police officers after a debriefing episode that they felt worse talking
But
about
what
the
was that
incident.
research, right? Did she talk to a couple cops, or did she,
right.
you know, like,
Right.
what was that research? So yeah, I mean, and that goes back to really the main problem we all have with the book is it's just it's just too shallow. You know, there's not enough research, you know. So she brings up these good points, she throws them out, and you know, as I said before, my concern is that the parents are going to pick up this book, and because their kids struggling, and they're going to say, oh well, I definitely don't want to do therapy, look what that does, you know. Where some kids truly benefit, I mean, I think we've all seen it, truly benefit and heal through therapy. And sometimes, you know, April, to your point, it just is talking. It's just having an adult to validate. I mean, one of the things that came out of ACEs, which she also refers to, was, you know, having one person, one adult, that can be the custodian at their school, that can be a therapist, that can be a parent, it can be any adult, right? But just having that one person to give them that undivided attention and, you know, just listen to them and validate them, you know. And I think that's crucial. And oftentimes that's the role we serve with this population. You know, we give them that space to just be themselves, to say whatever they want without judgment. So, and sometimes that's all somebody needs.
Yeah, absolutely.
Yeah. Yeah. So, I don't know. Anything else? Any other points that we missed?
I think just for me, I'm as unhappy as I was with the book. I'm trying to find some good things. So I think it was helpful for me, and just that reminder, even though I already do this to a degree, but I think the reminder of always doing those check-ins. So doing those check-ins with my client, those check-ins with myself, check-ins with other colleagues. I love that we have supervision with other therapists in our area, which is so great. But how important those check-ins are, just to make sure not doing any of these things that, you know, that she does talk about, and just making sure, right, that my clients are feeling that they're being helped by the therapy that I'm offering or supporting them with. So that was helpful for me, at least just as a reminder to do that.
Yeah. It's like a good reality check, or like, okay, I'm really offended by some of these things, and am I doing any of these, or do you know, how do I make sure I don't come close to any of these things? And I think client feedback, you know, and I think REHR just started that. I think client feedback forms are really helpful, you know. So to give them, you know, send them a little email or something that says, hey, how'd the session go? Did you feel your needs were met? You know, is there anything you want to, you know, you would want to do differently? Or so I think that's helpful, because I think the form is easier than like at the end of the session, where I'll say, you know, I'll do kind of like a little bit of a feedback, but I think the form, they're alone, they can reflect, and they're not face to face. So I think that's helpful. Like I do feel it's really important that our agenda, if we have one, doesn't get in the way of their healing. You know, so it always has to be client-centered, client-focused, client-driven. You know, we may have an idea, you know, but it's really important that it comes from them, I think. Yeah. So what do you grade the book?
So I was looking before we rate it. So on Goodreads, it has a 3.99. And it seems that most people either gave it 1 star or 5 stars.
Wow.
Oh, so interesting.
So
Polarized.
interesting. Very
I'd be
polarized.
curious to know, like, who gave it what? Like, was it more professionals gave it one, parents gave it, you know what I mean? Or is it mixed? That's really curious.
Mm-hmm.
Yeah, yeah.
Yeah.
It
I
is
mean,
interesting.
as angry and as I don't know. I think I mean, on one level, I want to give it like less than 1 star. But I think it provokes communication. I think it provokes thinking. I think it gets us to talk about it, right? So I
Yeah,
mean,
I like a 1 out of 10 scale. I think it gives us a little bit more room versus the
Mm-hmm.
5 stars.
all right. So 1 out of 10.
1 out of 10, right? So, and also maybe give it a rating for you, and also maybe if I'm thinking too, if any of my clients would benefit from this book, because this is kind of part of the reason why I wanted to do this book club
Mm-hmm.
too. But I don't really think any of my clients would necessarily benefit from reading it.
Mm-hmm.
But anyway, so you can go first, right? Scale of 1 to 10.
Mm-hmm. Mm-hmm.
So for my clients, I would be nervous with them for them reading it. So I would
Yeah.
say like 1, because I think if you read it and you take everything as facts, and in this day and age of fake news, I mean, it's just like if you want to read it and we'll talk about it, or talk about it with somebody else, or challenge what she wants to say, that might be a little different. So I would say 0 or 1 for clients. But for other therapists, or maybe even parents, if they want to read it with a discerning eye, I don't know, maybe a 2 or a 3
Mm-hmm.
out of 10. Out of 10.
Mm-hmm. I feel the same. I don't think I would feel comfortable recommending the book. I do appreciate the provocative nature, right? That really wanting to kind of put an opinion and a point of view out there,
Right.
and get people to have conversations around this, right? That can be helpful for sure. Yeah, I would probably go for that reason with a 3 out of 10.
Okay.
Yeah. But it's not necessarily somebody that I would say, okay, yeah, read this, and
This is an excellent source. It'll answer all your
yeah,
questions.
yeah,
Yeah.
exactly.
Yeah, I would say not even based upon necessarily my opinion or more my anger in reading it, but just the general idea that I don't really feel that she researched what she needed to research. She didn't really talk to therapists. She didn't talk to people who maybe were getting something out of therapy. I think it was also she definitely also specified, I think, a specific population of people as well. So I would say 1.5.
Yeah.
Yeah.
I think that, that is important to follow up on. It does seem like it was a very homogeneous group.
Yeah.
People of means and privilege. So
Yeah.
Yeah.
Yeah. And yeah, for sure. And racially homogeneous too.
absolutely.
Like the majority was of the patients and the people described were white. I mean,
Yeah.
I know she referenced a couple other ethnic groups and racial groups, but yeah,
Yeah.
for sure.
Yeah, that's important to think about too. I mean, now, the 3 of us are all in private practice, but prior to this, we have all worked in community mental health as well. So, right, I think that does say a lot to the population that she used in this book. It hasn't really included a lot of people that I have worked with in the past and now. So.
Yeah. Yeah. I agree. Okay. So I think when we post this, we'll put that review. And I think that is one of the reviews that has other books, alternative books listed. It may not be, it may be another one I read at the same time. But I think we should do that too. We'll post some books that might be really helpful for parents who are struggling with teens, and like that might offer a little bit of a different viewpoint.
That's a great idea. Yeah.
And researched, interventions and things like that. So, yeah.
Yes, and so we're going to continue to do this, review other therapy books. So if you have any ideas, reach out to us. Books that you feel like would be helpful for us to read or review.
Yeah, and we're having other therapists join too. So.
Yes.
So, all right, good.
All right.
Thanks for inviting me.
Yeah. No,
You're always welcome anytime.
You're a core member.
You're a core member. All right. Bye.
The core. All right. So Until next book.
Till next book.
All right.